And let's go ahead and begin. I will pay attention to the waiting room and admit people if they are coming in a bit late. There were a few more names on our list of pre-registered individuals. So, but we're going to go ahead and get started. My name is Ingrid Provident. I am one of the therapy ed instructors. I have been teaching for therapy ed for about 7 years, and prior to that, I have been a faculty member at major universities in Pittsburgh, Pennsylvania. I retired from Chatham University 2 years ago, and I maintain a faculty emeritus status. I currently work for Select Rehabilitation as an education specialist, but I am very happy to be here this evening as one of the facilitators of this presentation. Tom, do you want to introduce yourself?
Sure. Good evening, everyone, or good afternoon for the West Coast people. My name is Tom Fisher, and I am a therapy ed instructor and have been for 10 years. I recently retired from Indiana University and am teaching with therapy ed and doing some other consultant work. I am looking forward to the conversation tonight.
All right, so let's just go ahead and jump right in. So with any presentation, we have some learning objectives, and we are hopeful that by the end of tonight's presentation that you understand how the use of therapy ed resources can increase clinical reasoning skills for exam candidates. And oftentimes we use that word exam candidates for the students. We hope that you can appreciate how students can access the therapy ed courses that are hosted by a university or offered online. And we're going to talk to you a little bit about some of the information that we share with students in our courses. And then finally, we are going to describe the use of the AI learning assistant. So this is a brand new added piece to our therapy ed practice exams. And we want to show you how this learning assistant can really be very useful as a formative learning tool for exam candidates as they review therapy ed practice exams. So let's go ahead and begin. So all of you, I would imagine, have had some background in Bloom's taxonomy and understand how different. Yeah.
Ingrid, you were going to launch a poll, I believe.
Oh, Tom, thank you.
Nope, that's why we are co-instructing tonight.
That is exactly right.
And while she's pulling that up, we want to share with you that Therapy Ed had a focus group with some program directors at the Education Summit last year. And this is one of the topics that you all said you thought would be helpful.
So you should see a poll, and I see some of you already answering that. Have you hosted or co-hosted a therapy ed course at your university? So we were just kind of curious of our audience, how many of you are familiar with the therapy ed courses, and how many of you maybe this is new. So we have about 14 of you who have answered thus far. There are a few of you that may not have gotten your answers in yet. So I do encourage you to utilize that poll that should be on your screen simply with a yes or no click. Yeah, we're getting a couple more now. All right, so you should be able to see the results here. We have 11 people, or 69% have hosted or co-hosted a course at their university, and 30% have not. So for some of you, I think this will be new information. So thanks so much. And Tom, thank you so much for remembering that detail. So as we are jumping in, what we'd like to do is to start talking about clinical and professional reasoning. But first of all, we want you to recognize, and many of you I'm sure do, that there are different levels of exam questions. And one of the things that we teach exam candidates is that not all questions are written at the same level. So a knowledge-based question where exam candidates might be able to read information, memorize it, and regurgitate it back. We remind them that there are no questions like this on either the therapy ed exam practice exams or the NBCOT exam. A question like this might be, what is a CVA? And they would see questions that would say, one of which the answer would be cerebral vascular accident, something that they could just memorize and pretty much pick out. Then we explain comprehension questions, and comprehension questions are where they have to understand information, perhaps understand about a diagnosis. And there are very few items like this. And so we remind them that a question, perhaps a comprehension question, would be something along the lines of, if a person has had a right CVA, where might they see the deficits in the person's body? And we would give them, some multiple choice answers like the upper part of the body, the lower part of the body, the right side or the left side. And, many students have no trouble here either. Right-sided CVA, they would recognize left hemiparesis and, so they answer that. But we also remind them there's not many questions like that on the exam either. And we explain that questions are written at the higher levels of application or analysis, where they have to apply rules and procedures or theories, as well as perhaps interpret evaluation data. And so I give an example like, if a person had a right CVA and you had to do transfers with them, how might you transfer them if you were using an NDT technique? Now, this is more complex of a question. And so we remind students that they have to think about the comprehension that they needed, knowing that there was a left-sided weakness, use the NDT technique where they promote weight bearing on the left side. And so an answer where a person would stand and pivot towards the weak side would be an appropriate potential answer. So we just wanted to start off by sharing that we do spend a fair amount of time setting students up for success in the courses by examining and teaching them how to really think through and dissect questions. So I'm going to turn this over to Tom, and he's going to describe some of the critical reasoning that we reinforce in our courses.
Thanks, Ingrid. And again, this is not new information for you all, but for students to become more aware of this as they become exam candidates and to be successful, it helps them in looking at the items and understanding what kind of reasoning are they needing to use. So the first one is this inductive kind of reasoning, which uses knowledge of specific situations to generalize to a larger population or broader situations. So it's a judgment call. Is one of the things that we share them, and they're not always going to be the right judgment call. And so if the item is presenting in a fashion that they need to be reading it critically to see what the key words are, to see if in fact they're answering it in the correct manner. So it's sort of diagnostic thinking. For example, if they had a patient while they were on fieldwork level 2 and had a stroke and they had these sorts of symptoms, they are presented with a case that had a stroke, they could be thinking about that kind of situation and generalize it to persons with stroke on the right side, as Ingrid said earlier, would have left hemiplegia, maybe left facial droop, etc. Then there's also some deductive reasoning items. And those use knowledge, guidelines, and general situations to apply to specific circumstances. And those are what in hand rehab typically we follow. So if a person has a flexor tendon repair, there's something that we can do at week 1. There is something that we do at week 2. So there are guidelines and there's not much deviation, similar to using physical agent modalities. The temperature is at a certain part, the duration is and that those are guidelines. Analytical is much different. It's determining the means and the parts of the whole, and we show them in the course this pie shape of the domains that are tested on the exam. That there are 4 domains, and here are the percentages of the domain. Then we ask, what does this particular pie chart tell you? And then they share that 38% of the items are actually in the domain of selecting and managing interventions. So they must know interventions a lot to be successful on the test. Then there's inferential, determining what may be true in a future situation, the best course of action. So it's that inferring of information. And then we have evaluative, which is determining the value of the information provided. Does it have any weight in the situation? Does it hold any water? So a person with shortness of breath, if they have COPD, that is something that we should expect. But if they're short of breath and that isn't a diagnosis, then they should be paying attention to that because that's giving them some information. So as Ingrid shared, the majority of the NBCOT test questions are actually at the application and analysis. And so in the application and analysis, then we move into what maybe you call professional reasoning in your program, but clinical reasoning. And there are 4 different types of clinical or professional reasoning, and we're going to go through those really quickly here. But they need to know these reasonings for both the multiple choice and the scenario set items. As you recall, this year, NBCOT took away that clinical simulation and replaced it with these scenario set items. And so they need to recall procedural reasoning. And so we go through what is procedural reasoning. We go back maybe to the CVA again and say, okay, the person's had a right CVA. So what are we going to look for in terms of signs and what symptoms are the patient going to present us with? What is the etiology? And they say there's 2 different types of strokes. There's ischemic and there's hemorrhagic. And so with a hemorrhagic, the prognosis is going to be much more guarded because more of the brain has been affected. So that's their procedural reasoning. Then we have conditional reasoning. And in conditional reasoning, it really is a lot of the heart of OT, right? So we emphasize during this kind of reasoning, we're thinking about the roles, the interests, the values, and the goals of the client, being a client-centered profession, that we emphasize to them that is a person who has had a stroke or a person who has had a spinal cord injury, not the spinal cord patient or the stroke patient. And that what are their roles? What are the roles they want to reassume after this recovery process? And the trajectory of the prognosis based on what they know is about the condition. Then we have interactive reasoning, and I share with them that I was a director of a rehab hospital outpatient center at one point, and that OTs rock this area in terms of establishing rapport. This is the interactive piece. When do we involve the families? When do we involve parents, caregivers? And then now we're able to talk about, even with caregivers, we are even able to now bill with the CPT codes and talk a little bit about the CPT codes for caregiving training services. And then finally, we have the pragmatic reasoning. And pragmatic reasoning is, again, talking about lengths of stays, the types of settings, so that they need to realize that OTs practice in school systems, they practice in acute care settings, they practice in skilled nursing facilities. And what do you remember about these kinds of settings? Because the test items may talk about that. So they need to know that they need to be in the acute care for 3 days to qualify for the 100 days of post-acute care in the skilled nursing facility or rehab facility. They need to understand that the legal responsibilities of a health professional to actually report if the patient has indicated that they're suicidal or homicidal, and those sorts of pragmatic types of situations. So I'm going through really quickly, but you get the gist that during this course, we go into this quite elaborately so that they start to realize they know a lot of this. They just need to bring it forward at the time of the test.
So what we wanted to do is to give you an experience with 2 of the questions that we use within the course. But I also wanted to remind you that if at any point in time you have questions or anything that you want to with that for us to handle at the end, then please go ahead and use the chat. At this point in time, I am going to go ahead and launch a poll and have you read the question that is on the screen and pick the answer that you believe is correct. I'm going to end this for 1 second so that you can see what's on the screen. Read the question, pick the answer that you believe is correct, and then I'll give you the opportunity to go ahead and answer that multiple choice question. All right, you should see the opportunity for you to pick either A, B, C, or D as your answer. About half of you have answered. Don't be afraid. It's really okay if you pick the wrong answer.
It's anonymous.
Yeah, we can't tell. All right, we have about 68% of you who have participated. I'm going to go ahead and share the results here. So 100% of you selected A as your answer. And I think you're going to be very happy that you selected the correct answer. And we do a very similar thing in the course. But what I did want to share with you is that we share the rationale for what makes the correct answer the correct answer. So in this case, you can see here that the first step is always to evaluate the skin integrity, especially for older adults. And we go on to describe exactly what makes that answer correct. We identify each question with a particular type of reasoning, and then we remind the students what that reasoning is actually all about. So we're going to go ahead and do a second one here, just so you can kind of see the difference, but still the level of the question. So go ahead and read the question, choose your answer, and then I'll give you the opportunity to put that in that poll again. All right, you should see the opportunity to put your answer here. We're right at about half participating now, so go ahead and put your answers in. All right, we're just a little over half, but again, for the sake of time, I'm going to go ahead and end that. And you can see here we have a lot of disparate answers, right? We do have 67% who have selected B as the answer, but we have answers for A, C, and D as well. And this is more typical of what we see when we launch these kinds of questions to the student groups. And so what we would do is, again, share that the correct answer here is secondary prevention. And we would share the rationale as to how secondary prevention programs would aim to provide the early detection for a group that has already had a diagnosis. And that these are population prevention programs. We would share that primary prevention reduces the risk or disorder within a well population. Tertiary prevention programs eliminate or reduce the impact of dysfunction in a chronic condition for long term. And then case-based is not a population-based model of care. It's an individualized intervention. So again, we try to really provide good, solid rationale so that even if a person selected the incorrect answer, that they begin to see that the textbook definition is what is going to help them when they go ahead and start studying.
So what therapy ed practice tests are, they're a part of the review and study guide, which comes with the course, or students or exam candidates can purchase it without coming to the course. And there are 3 of those available, and they simulate the NBCOT experience. We share with them that that first one is sort of a diagnostic one. So they can, if they want to do some studying and then take one and get the following feedback, they get an analysis of their strengths in test taking, their knowledge gaps, the flaws in their thinking, and how to improve their performance patterns from that first diagnostic to then save those other 2 for later once they've done some study. So they strategically incorporate these online practice exams into their exam prep plan. On day 2 of the course, we actually give them some examples of how to, because they all want to know how many weeks should they, study before they take the test. And what most of us, I believe, are saying is that it should be 4 to 6 weeks is a good. Now, some will be taking it in 2 weeks, and then they raise their hands or they ask us privately, is that too soon? Should I not be taking it? And only you can make that decision. If you have been studying and you're, and are committed to the hours to put into this, then 2 weeks might work for you. But generally speaking, 4 to 6 weeks. They get they get a code that they can actually go into the Therapy Ed online learning portal. And we're going to show a screenshot of what that looks like. They access their code and they set up an account. They select the exam and then they complete it. They review their results and the study rationales that are provided for them before they take their second one.
And I wanted to point out that these tests are available to them for a full year. So once they access that learning portal, they have access to these tests for 1 year. They can only take the tests one time, but they can review their reports as many times as they need to.
And so this is a screenshot of what that looks like on our website. The arrows pointing to the practice exam, and over to the right, there's another selection for the practice test, so they can find them pretty readily. It's, again, these exams are over the 4 domains that NBCOT has on the test. The 5 critical reasonings that we talked about, and then the 9 content categories, infants and children, older adults, rehabilitation, competency management, OT process, all those categories have the exam questions about them. They identify the questions answered correctly and incorrectly so that they can go back and review all of them, as Ingrid said. And then after completing a full exam, they can access the use of the AI online learning assistant to answer questions and provide additional information to enhance their understanding of this content. And Ingrid's going to share a lot more about that new product.
So
remember, go ahead.
Okay, so we do try to let the students recognize that what their percentage report from the therapy ed exams are not necessarily indicative of what they're going to get on the NBCOT exam, but rather we have created these exams so that they can really look at these reports, assess their strengths and weaknesses, and then develop their exam preparation plan. So what we wanted to show you were some screenshots related to what do they see after they've taken a practice test. So the first thing that they would see is that they have 3 practice tests that are available to them. And on this screenshot, you can see that this particular individual has completed practice test exam A. So they have received 70% accuracy. And I don't know if you can see my little cursor here, but if they clicked that view report button that's right on that right-hand side, what they're going to see is the first screen that they would see is that they got 136 out of the 195 questions correct, which gave them the 70% accuracy. Now, this particular person took 1 hour and 8 minutes to do the exam. Now, they have 4 hours to take the exam. So, in my opinion, this would have been very fast, a very fast test taker. And so, perhaps had they taken a bit more time, their accuracy would have increased. And so, again, remember they have 3 tests that they can use. So, the second test, perhaps they'll notice if they took more time, their accuracy would improve. I also want to be very clear that one of the things that we are quite proud of is that there are no repetitive questions in any of these 3 exams. And so the students will always see a new and novel exam item. Now, as they dig deeper into these performance reports, they will see that again, they got 136 items correct, and they can click on that and review their correct items, or they can click on the incorrect items and it will take them through the 52 items that they got incorrect. This screen shows you yet another layer of the report, and this shows them their responses based upon their areas of reasoning. So there were 14 items in analysis, 21 items in deductive, 30 items in evaluation, and 40 items in inductive reasoning. So again, they're getting a report based on lots of different breakdowns of the same questions as they're categorized. Um, Here they see how they did with each of the domains. And here they see, so I'm going from left to right. The right hand screenshot gives you the 9 topic areas. So you're just seeing the first 4 here, but as they would scroll down, they would recognize how many items were related to each of the particular content areas. Another way that the reports are broken down is to give them the 4 domains, but they rank them in order of less or least successful to most successful. So this particular person's domain 1 in evaluation and assessment, they had the most number of incorrect. So in other words, they only scored 57% accuracy in domain 1. And in domain 4, they had 69% accuracy, and you can read the numbers going down. But also the color changes. So this 76% accuracy goes to yellow. And we use this red kind of like a stoplight. Red, stop, take notice, pay attention. Yellow, be somewhat cautious. And green, if you're kind of good to go. And so there's these visual representations that allow students to make sense of their particular score reports. Another way that it's broken down is based upon the different reasonings. So again, we really do try to give the students or exam candidates as much information about their own personal performance as possible so that they can hone in on the areas that they are weakest in. It's a little intimidating, somewhat overwhelming to get that big review and study guide and feel like you have to open it up and read from the front cover to the back. And in this way, we are hopeful and explain to exam candidates that they really should focus in on the areas that seem to be their deficit areas. So it allows them to more target their exam preparation plan. Again, as you can see, the same kind of thing, ranked from their lowest score to their strongest score. So this particular person scored 55% in the questions that were related to the musculoskeletal system disorders, whereas they scored 85% accuracy in the questions that were related to human development across the lifespan. And so if I were interpreting this with a student, I would say you don't really want to spend too much more of your study time on human development. You're probably pretty solid there. But let's take a look at some of the biomechanical approaches or the neurologic approaches because you're scoring in these red categories here, these areas that are your lower performing areas. The other thing is they dig down deeper and they review each and every question, very similar to the rationale that you saw when you were answering the questions on those two questions that we provided for you, is that they will um, again on their screen, they will see again the question exactly as it existed when they answered it. They'll see the answer that they put in there, and then they will have the explanation, the rationale related to what made that answer correct. It will identify the type of reasoning and again remind them of the reasoning. What we
I
think is really cool. Go ahead,
I was,
Tom.
I was just going to ask if there's any questions at this point, because I don't see any in the chat, and we don't want you to forget them and wait till the end. And what we tell,
So good reminder.
okay, we have a note. Thank you. So far, so good. Good. Okay.
All right, terrific. So what I wanted to really bring your attention to, and that one of our learning objectives for this evening was to share with you what we are quite proud of related to this learning assistant, this AI-enabled learning assistant. So let's say we have a student who is reviewing their questions and they're kind of wondering, well, I wonder why the answer that I picked is incorrect. What the AI assistant has available to them are pre-populated questions relating to that content. And they can click on that question and they will get another rationale. So it's a way to kind of dig deeper into that particular question as they're thinking about additional questions in the review of these particular questions. But they can also ask their own question, which I think is a really cool, unique feature here. They can type in, and you can see on the left-hand side at the very bottom, there is, this little window where a student can truly type in whatever question they have, either related to that question or anything that, they're thinking about. And how that AI learning assistant goes about answering that is they will screen the review and study guide first to find information related to that. So we know that that information is coming from a reliable source. I have also been told that it will scan other reliable sources on the internet, and then they will populate the answer immediately back to the student. So it's just like the AIs that we are using in Chat GPT or our Google searches, but we're bringing it to the student, the exam candidate, as a way to be a bit more of an interactive learning system. So they can only access the learning assistant once they're reviewing their test questions. So they can't access this until they have taken at least one practice test. And so we're really trying to build in this habit, if you will, to have the students answer all the questions in the exam, get the experience of the timing, the report for how they're doing, and then they have access to being able to utilize this learning assistant as a deeper dive into particular content. So the learning assistant doesn't only work with our multiple choice questions, it also works with these multi-select questions. And so just a reminder, and I'm sure many of you are already familiar with this, but sometimes we have student groups who really are not, they haven't practiced these. And how these are structured are that there are 4 questions that kind of go in a linear manner that mimic the occupational therapy process. And so the first question will be based upon evaluation. And then the student will need to read the occupational profile, if you will, and then select the 3 best choices that are applicable to this particular scenario. So you can see here, this would be about the amount of information that they get, and they have to choose the 3 that are based upon picking evaluation processes. And so the students would choose the 3 answers, and then there would be, again, the rationale related to the 3 correct answers, the type of reasoning, and you can see here, domain 1, evaluation and assessment. The second question would go into intervention. The third question would go into perhaps an ethical situation or a reevaluation. And then the fourth question linked in this same scenario set would be related to discharge. So it simulates the thinking that any of us as occupational therapists would need to do to progress a person through the occupational therapy process. So these questions are woven in the test. They may answer 15 multiple choice questions and then have one of these multi-selects. So we familiarize them with that when we teach the therapy ed course.
Ingrid, there is a question in the chat. It's
Mhm.
in regard to the AI assistant, and the question is there a limit to how many questions a student can ask the AI assistant?
My knowledge, absolutely not. There is no time limit. There is no number of question limit that the student can ask. The only thing that they have to have done in order to access the AI learning assistant is to have taken a full practice exam, because the AI is linked to each particular question. But they can ask outside the scope of that question as they are, reviewing that information.
Okay, thanks.
Thanks for the question. All right, I'm going to hand this back over to Tom.
Okay, so general exam prep strategies are what we share with them is that they need to revise and update their exam based on the diagnostic tests and then analyzing themselves and the performance that they've had on the practice exams. And then just like we do in the OT process, then they implement that revised study plan. We share with them that there may be circumstances that happened when you made your plan and now all of a sudden you're moving, or something else, life situation presented itself, so you're not going to be able to keep to that week schedule. That's fine, but then put that study time into a future week so that you get the study time that you actually had planned, because acquiring that needed content knowledge is absolutely critical. And then they're going to apply their knowledge to the additional therapy practice exams as they progress through their plan. And again, as we said earlier, regardless of their score on the therapy ed exams, simulated exams, they cannot think that's how they're going to do on MBCOT, but they need to be thoughtfully reflecting on the extensive rationales that have been provided, critically review that computerized analysis that you all saw the screenshots of, and revise and update their exam preparation plan based on these reflections and analysis. So we say it's likely that their preparation for MBCOT exam has been adequate if they understand the item rationales. If they're still struggling with understanding why the rationale for the correct answer is not the correct answer, we, just like in class, we don't take a lot of time if we would see us at break or see us at lunch, and we'll talk to you more because we don't want, if everyone else is ready, to move along. If their errors are scattered over a diversity of content areas, so there were some adult physical rehab questions that they had some challenges with, some children and youth prompt issues, some productive aging that is not one content area, then that's probably okay. And that they were answered wrong required a different kind of reasoning. So instead of inductive or deductive, it was the analysis or it's evaluative. And that their errors were typically made in complex questions. Their MBCOT exam preparation is likely insufficient if the areas are clustered in a major content area. So if they have a lot of feedback given to them through the practice exams or in the course with that we provide these a different set of questions, that pediatrics just was not resonating with them, then they're needing to go back and review that content area because they're not performing in that particular area of practice. Or if they're not understanding the item's rationale, when they're provided, they just still don't recognize what that rationale is saying. Their errors are about the foundational OT principles and well-established, standards in our practice. So if they don't understand the OT process or they're not really understanding some of the basic foundational, we will encourage them that their preparation is not sufficient and that they need to spend a little bit more time studying. The items that are answered incorrectly require one type of critical reasoning to determine the correct answer, and that their errors reflect the persistence of test-taking personalities that is not effective for exam success. And on day 2, we talk a lot about the test-taking personalities that are well established in the literature, the second guessers, excuse me, the philosophers, and identify who they are, because they do need to have a self-reflection of who they are as they enter this test. We emphasize that the test has 2 parts, the test and themselves, and they have to enter into this test that they're ready to knock it out. They're going to do this. They cannot go in saying, oh, I do horrible on these kinds of tests, because that's what will happen. Registering for the course, back to our website, the orange arrow is sharing with you where the courses, where they would click on. And so depending on if they're doing a level 2 somewhere or a capstone somewhere, they can look to see if they want to do an in-person. All the courses are listed, as you can see on the right, the dates, whether they're online or whether they're in person. The other resources we have are online office hours, and I see a question in the chat about the office hours. You assist students in reviewing and interpreting their results from the practice exams. Those are not part of what office hours do, but it would be a part of what tutoring would do, which you see on the right side of the slide. So there are instructors who do this one-on-one tutoring or small group tutoring, and it's a fee-based. They're both 60 minutes. For the online office hours are hosted by one of the instructors of the therapy ed and in our content area. And we have another, but I have been asked to share their scores breakdown. I will get to that question, Jane. Thank you. In terms of the online office hours, here are some examples, and there's dates usually to the left of it, and those can change. So you go to our website, we encourage them to go to the website, see what the topic is. Sometimes instructors do have to change, and so that could change. They are recorded, just as this will be recorded and saved to the Therapy Ed YouTube channel. And they are posted 48 hours after the online office hours, and they're available for 1 month or 4 weeks being posted. And again, these online office hours are free. And so if students or exam candidates are feeling like, splints and orthoses or something that I really could do a review on, they could go to the website, see when that online office hours is, see when that particular conversation is happening, and scheduled to be there.
So another feature that we offer is this exam item of the week. So for those who are on social media, Facebook or Instagram, every Thursday we post a new question. And the way that this works is to kind of begin to have the exam candidates thinking about a particular topic. So the focus of the exam item that is posted on Thursday will be the topic of the following online office hours the following Tuesday. So Thursday, the question goes up on Facebook and Instagram. Sunday, the correct answer with the rationale is provided. A reminder on Monday that online office hours are related to that particular topic. And each week we kind of keep that flow going. So as Tom so nicely pointed out, we have this rotation of a large list of information that comes from the review and study guide that we go through as another active way for students to review this content. We offer an app. So the app is another exam prep tool. It is available for a fee. There's a 12-month plan. What it has is the 510 multiple choice questions from our review and study guide, the last review and study guide. It still currently has the clinical simulation exam items. These were those yes and no's, but we are updating that. So we do try to be very transparent with students that this is yet just another tool. The nice thing, or what differentiates the app from the practice tests, are that students can take a couple of questions on the app. So maybe they want to do 5 questions a day, or they want to just do a few, at whatever point in time. What they can't do that with the practice tests, because the practice tests are intended to be taken in 1 4-hour time frame. So it's just a different way of accessing test questions. So we want to be here to support you, and we want to be here to support your students. So any students who may have taken a therapy ed course and have been unsuccessful on the NBCOT exam, they can take the test again with no additional charge. They can simply contact our office and register for either an in-person course somewhere geographically close to them or an online course. We also have program director manuals that are available, and these help to describe how therapy ed materials can be woven into your curriculum. We have different program director manuals for pre-accredited programs, accredited, and developing programs. So if you're interested in that, we would highly encourage you to reach out to Betsy Pendry to find out information about that. And we also offer program assessment exams. And so these are exams that can be given to a cohort of students where you receive the results of that. And so you can take a look at, are these results indicative of perhaps some curricular areas that maybe need shored up a little bit, or are your students where they need to be? And so you can, before students are dispersed for either field work, or maybe you bring them back after field work or between capstone, you can take a look at this from your entire cohort. So these program assessments are free for the first cohort use, and then they're $20 after that. Again, Betsy Pendry is the best person to reach out for information related to that.
Yeah, and Ingrid, I'm going to ask if Jane, is that something that maybe you're thinking about? Because in the chat, you put that you've asked them to share their scores in the breakdown. And is that from our practice exams that they're taking?
Yes, and I apologize. I saw the message from Sarah Nielsen. We're colleagues, and I thought she sent me a private message, if I'm being honest, and I thought I was just replying to her. So I apologize. I didn't mean it to.
No worries, no worries. But
Yeah.
this might be the tool that you're thinking about, that
Yes.
Ingrid just discussed.
Yes, yes. I have had students share their results more because I was just curious. And so I could tell other students if they were taking this course what they could expect. So, yes.
Good, thank you.
You.
Just a few more resources, and then we have time for any questions that you all might have. If you're curious about learning more about the Learning Assistant or seeing it presented live, we have the owner of our company, Tom Pendry, and another one of our therapy ed instructors that are hosting a lunch and learn on November 9th if you are going to the Education Leadership Council meeting. So you can, again, contact Betsy Pendry, get yourself signed up for that, and they will be diving a little deeper into that Learning Assistant at that lunch and learn at the Education Leadership Council meeting. Also, if you want to see this from the student's perspective, our next online office hour next Tuesday, October 22nd, Dr. Paula Carey and Amy Bryant, two of our other occupational therapy ed instructors, are going to be sharing a little bit more about the learning assistant. So if you have students who you want to encourage to attend that, we can host up to 500 people on these online office hours. And again, they're recorded and posted on the YouTube channel. So we are at time. I have a couple of additional polls that I wanted to ask you to fill out. But also, this is a great time for you all to give us some feedback and or ask any questions that you might have. So I have one poll up in front of you all here. Do you or will you encourage students to attend a test preparation course or utilize therapy ed resources? Oh, so thank you. Thank you for that. We are certainly here and want to be helpful to each of you as far as your programs. And then our final poll question here is, have you learned anything new or useful in this webinar? And if you answer yes, there should be a second short answer there that you can provide to us. What was new? So that we know what to continue to include as we provide these webinars, etc. So thank you. And again, in the chat, if you have any questions, any feedback to us, we certainly can take that back to our entire group and are happy to provide any information that we have that would support you in your role.
So at this point, are there any questions that you all want to ask us? So there is one in the chat that's putting kids to bed. I've heard from some former students that they find the therapy ed questions more challenging than some other common studying platforms. I'm wondering if that's a common feedback, and if so, if it's intentional.
So I always tell students that that is information we have heard, and it is information that we kind of both appreciate. We would like to keep it pitched at thoughtful, having students well prepared. I think that going into the MBCOT over prepared is a really good thing. When we are at AOTA and different areas where we have students that can actually talk to us, they have told us that it has been a really good test preparation item, and that the rationales have been incredibly helpful. All right, so I'm seeing that many of you feel like you've learned something new and useful. So for that, I sincerely appreciate that. We can review your short answers. And for those of you that need to leave, thank you so much for your time and attention. If anybody wants to hang on to ask any other questions, please feel free to do so.